Good morning, everyone. Hi there. My name is Cynthia Queen, and I'm the Member Services Director for your San Diego City Employees Retirement System. It is wonderful to see you all here today. I'm thinking, we know how to throw a party. Wow. It really looks big when you're standing up here. This is the first time for this event. I'm so pleased. When there was only about 10 people here before, I was getting a little bit nervous, but this is very important to us because it's very important to all of you, and I'm so pleased to see you all here. Thanks to those who are bringing chairs around. We definitely have more chairs. If you feel like you can't quite see, just move yourself around a little bit. We've got the big screen going here. I want to make sure everybody's on the same page. We are going to hold the Retiree Health Open Enrollment from June 1st to June 30th, just like we do every year. And additionally, we are going to hold the ever-popular Health Help Day on June 17th. That is the event that is held here in this room, where we have the tables all around, and there are no formal presentations, but you get to go and speak directly to your providers, to the different vendors, to the SDCERS folks, speak directly, get your questions answered, turn in paperwork. That event will be held. So this event is specifically set to be a preview of the information so that you can have an overview, some of which you might already know, some of which will raise more questions for you, and to get everyone prepared so that you can do some research before we get going with open enrollment, give you a little bit of time. So it's interesting that the way this event came about is through talking with our customers, speaking with the folks who call us every day with various questions. And this event is the result of a partnership with you, our customers, and your retiree associations. There is a joint group of leaders of the associations known as the Retiree Issues Task Force. And a group of those folks asked me to organize a meeting with the city leaders who negotiate health care. And at that informative meeting, the idea for this workshop was born. And I would like to thank the president of the task force, Mr. Dave Hall, my friend. Give us a wave, Dave. Dave made this all happen, and he encouraged Mia Alomar to work and bring all these people together, which really was quite an effort, and we're very pleased to be here today with you. Now, Dave is a former trustee on the SDCERS board, and I'd also like to thank our current retiree representative on the SDCERS board, Richard Wilkin, over here. I want to thank Richard for his continued advocacy of the retiree health program. He keeps me on my toes, keeps us focused, reminds us of the issues that are very important to all of you, and helps with the materials that we send out. We actually utilize the associations as editors of our materials that we send out because, believe it or not, Mia and I are not yet in Medicare, and so sometimes when we send out those letters, we need some additional help. And I didn't think anybody here was in Medicare, but several of you informed me that you were, so you all look great. All right, so let's get this set up. It's true, and we all know this, that the world of healthcare is ever-changing. Someone used the word that it was daunting. I feel the same way, just providing coverage for my family. There are so many choices out there and so much more to learn, and no one has all the answers. But what we want to do today, our goal is to provide you with an overview, of course, and direct you to the proper resources so you can do your homework and feel confident about what we're all getting into, and maybe if you're going to make a different choice or feel good about the choice that you already have. And this is most certainly a team effort. Your health coverage is administered by the City of San Diego, and then it's processed by the SDCERS staff in partnership with the healthcare providers. And of course, we all know and are proud that we are here to serve you as our customers, and we want to make sure that we're getting you the information that you need. I'd like to introduce the team that we have here today. First, we have Mia Alomar of SDCERS. Mia is the Member Services Manager, and I would appreciate it if you would all give her a big round of applause for putting this event together. No pressure, Mia. Then, in the back, I want a few folks to raise their hands who you said hello to on the way in. On the SDCERS Health team, we have Rosa Ceja-Manzo, Joy De Los Reyes, Sarah Levy, Angelica Aguilar. And now if I could turn your attention up here, I'd like to go down the table of our presenters today. We have Kathleen Bryant from HealthNet, Kimberly Shields from HealthNet, Charlotte Souza from Kaiser, Nancy Valero from Kaiser. Actually, her name's Nancy Voltero. Can I say that one more time? Nancy Voltero from Kaiser. And then Nancy Stadilli from the city's risk management department. Did I get everybody? I'm looking back there. Michelle, thank you. Michelle Knapp, as I'm looking, there we go. Michelle Knapp from Kaiser also. We got everybody up here so we can work on this. In fact, we have such a comprehensive bit of information that we're actually going to do our Medicare 101 bit twice. So Medicare 101, Medicare 202, because I know that's an important topic to everybody. All right, just quickly, I want to go over what our agenda is today. We're going to cover open enrollment, various types of coverage, the allowances and tiers, the reimbursement process. We'll have an overview by HealthNet, one of the city-sponsored providers, an overview by Kaiser, the other of the city-sponsored providers. And then, in partnership with these sponsors, they are going to talk to us about Covered California and the new marketplace, and an overview of Medicare. And then we will have a presentation by the City of San Diego Risk Management Department and the pieces that they administer, and particularly the options A, B, and C for those of you who utilize that. And then, hopefully, we will have a little bit of time left for the questions at the end, because we've got a lot of information to share with you. The idea is that if you have questions of course, of a personal nature, we're going to let you know today who to direct those to. But I'm going to gather the questions and review them and see which questions are of value to the whole group, and then we'll share that and also direct you where you can get further answers after that. So now, I'll get us going, and I'd like to welcome up here Mia Alomar, who's going to start out our first part. Thank you, Mia.
Hello, welcome. Thank you so much for everyone attending. I was not expecting this many people, but it's so wonderful. I really appreciate you all being out here to learn about the healthcare program that we offer. I just would like to let you know that in the seats we did have the index cards, and that if you could jot down any questions that you may have, as Cynthia stated, any questions that are more personal, if we could wait, and we'll be able to direct you to that individual person. But if you have a more broad overview question that you would like to address, please put that question on that index postcard, and we will be able to address that question at the end for our Q&A. Okay? Okay, as Cynthia stated, this is our retiree health care coverage workshop. Not sure if anyone raised their hands, if anyone thought that this was our help day, which is very different. But this is a workshop. It's our very first time doing our workshop, and it seems like there's a great turnout, so welcome, as I stated before. As Cynthia stated, the open enrollment is from June 1st to June 30th. That's an opportunity for you to enroll or make any changes to your health care plan. I just would like to emphasize the importance of getting all forms in by June 30th. Whether you are if you're transferring from one plan to another, if you're adding a dependent or deleting a dependent, there are different forms for different situations, so it is important. I cannot stress enough how important it is to make sure that you turn in those or submit those forms by June 30th of this year. Also, our help day will be in the same location. It'll be on June 17th. Right here from 10 a.m. to noon. And as Cynthia stated, this is an opportunity for you to meet with our healthcare providers on a face-to-face and other vendors that we have to address any questions, and this is a time to submit forms as well to our SDCERS staff. I am pleased to announce that there will be no changes to our healthcare providers. HealthNet and Kaiser will be joining us again this year. Please do, as I state, please expect for there's to be some changes in our rates, potentially to go up. So please prepare for that. When you look at the allowances, and we'll go through your insurance allowances, please prepare to see if your allowance will cover your premium costs, being that rates are going up, so that you'll be prepared to either pay out of pocket if applicable, or if this will give you an opportunity to look and see what plans are available if you choose to not do, if you look at the rates and you want to get a lower plan, that's the time to look into do that. So please be prepared for the rates to increase, okay? Whether you are this is your first year enrolling, or if you're a new retiree, if you're making any changes, As I stated, the open enrollment is the time to do those changes. However, there are times where you can make changes that are outside of our open enrollment period, and there are qualifying events that will allow you to enroll during outside of open enrollment. The qualifying events, you can easily contact our SDCERS staff, and they'll be able to let you know if the situation that you have is considered a qualifying event. That includes any type of changes that you have, and if you ever want to disenroll, you may disenroll with their SDCERS at any time. Dental and vision is quite different. For our dental and vision plans, you have to make the premium for the entire plan year. So you will not be able to disenroll or switch at all during the enrollment period for that plan year. However, there are certain situations in which you can make changes to your your dental and vision, but please contact our SDCERS staff to find out what those qualifying events are. Also would like to emphasize that if you've reached your maximum annual for your dental and vision, you are still required to make your monthly payment for the rest of the plan year. So please be aware of your plans and exactly what they require from you. The purpose of this is to educate you and to prepare you for any questions that you may have. If you are moving out of state, about 6 to 8 weeks prior to moving out of state, please contact your healthcare provider as well as SDCERS so we can help you prepare for that move, because you may be able to continue with your healthcare with the same provider depending on what state you are moving to. So please contact us and your healthcare providers to find out exactly the state that you're moving to. Would you be able to keep your health insurance? COBRA. I will not be speaking too much about COBRA because we have Nancy Stadilli here from the San Diego City's Risk Management Department to go more in depth on this topic. But I wanted to let you know that COBRA is available to you as well as your dependents you have 36 months to do that. So 18 months on the city COBRA and then 18 months on the Cal COBRA. Just to let you know that if you're looking to enroll, this packet, your enrollment packet will come through the City of San Diego's Risk Management Department, not SDCERS. On to our insurance allowances. The insurance allowances are here to cover only the retiree. The allowances do not cover any dependents or a spouse. So they're strictly just for the retiree. And your health insurance allowance, they vary by your retirement date. So we have different tiers. A group of retirees is our pre-1980. So those are our individuals who retired before October 6, 1980. You also have those individuals who retired between October 6, 1980 and June 30th, 2009, and then July 1st, 2009 to March 31st, 2012. And then we have our option A, B, and C members who retired after on or after April 1st, 2012. With the allowances, you can use the insurance allowances to go to your city-sponsored plan, which is healthcare, which is HealthNet or Kaiser, and that allowance will be applied directly to your premium. The SDCERS will automatically apply that allowance to your premium if you're on a city-sponsored plan. If you are not on a city-sponsored plan and you're with a privately secured plan, at that point you can submit proof and it will turn into a reimbursement. If you look at that last bullet, you can see that it says, if premium cost is greater than your allowance, the difference is deducted from your monthly pension payment. In other words, it will be an out-of-pocket cost to you. So that's why it's important to compare those rates to your allowances to see what plan will work best for you. I will go more in detail on each group in the next couple of slides. So our pre-1980 individuals, do we have anyone who retired prior to October 6, 1980? So these are individuals who receive a $1,200 annual allowance. So they get a maximum of $100 per month. The allowance can be applied to a city-sponsored plan, or it could be applied to a privately secured plan. The difference between the pre-1980 and some of the other groups that I will be discussing is that if they're in a privately secured plan, they have the ability to use that allowance towards other expenses other than just their premium costs, such as their Medicare Part B and D, prescription drugs, co-pays for hospital co-pays as well as doctor co-pays. And this is the only group that is allowed to apply that allowance to something else other than their premium cost. On to our October 6, those individuals retired between October 6, 1980 and June 30th of 2009. These individuals have one allowance, so they're not multiple tiers, which I will show you on our next slide for another group of members. But these individuals have just one allowance, and there's no sliding scale, so no matter how many years of service you have, you will receive 100% of this allowance. We have a Medicare and a non-Medicare allowance amount. And of course, with everything that this allowance that they have can be applied to their city sponsor plan directly, or they can, if they're in a private, they can provide proof and it will turn into a reimbursement. So a big question we get a lot of times from our retirees is regarding the 10% escalator that can be applied to your insurance allowance. A lot of times we get the question of, why doesn't the 10% escalator cover my health care increase? My plan had a 9% increase. Why doesn't my allowance go up to 10% to accommodate the health care cost? And I'll read verbatim from our San Diego Municipal Code. It states that after fiscal year 2003, the maximum payment of reimbursement level for health-eligible retirees will be adjusted annually based on the projected increase for the national health expenditures by the Centers for Medicare and Medicaid Services, Office of Actuary, for the full year period ending January 1st before each plan year. No adjustment may exceed 10% of any plan year. So my emphasis here is to let you know that we can provide an allowance that percentage can go up to 10%, not 10% every year. So the projected increase over the past couple of years has always been about 5 to 7%. So we haven't reached that 10% at all. So the average is from a 5 to 7%. So that is to answer your question that it is only up to 10%, not 10% in increase in your allowance every year. So as stated before, please prepare for the allowance not to exceed that premium cost and to prepare to pay for any out-of-pocket cost. Now on to our retirees who retired on July 1st, 2009 to March 31st of 2012. In this group, we have multiple tiers. So we have multiple tiers depending on your retirement date as well as your representation. So we have our members who retired between July 1st, 2009 and June 30th of 2011, and then members who retired between July 1st of 2011 to March 31st to 2012. Those two different individual groups receive different allowances. And then our last group is with our Local 127 and our POA members who retired between July 1st, 2000 and March 31st, 2012. So these are the multiple tiers that we have under the umbrella of those who retired between 2009 and 2012. Please remember that on this group there is a sliding scale. So depending on how many years of service that you have, you have to have at least 10 years to get 50%, up to 20 years to get 100, and it increases by 5% increments with each year, so 11 would be 55%. Also with these group of people, the years of service that you have, reciprocal time does not count. So if you're going from one agency to another and you have 5 years, and that 5 years help you get to 20, you will only have 15 years with us for health insurance. So that reciprocal time does not apply to your health insurance allowance and the amount that you receive. Also, for our unclassified and our classified unrepresented members, the purchasable time, the 5-year purchasable time, does not count toward your healthcare years that we also apply. If you are retired, disability retired, there is no sliding scale for those individuals. So you will receive 100% of maximum, or whatever your maximum allowance is. This escalator also will apply to the next group of individuals, but first allow me to show you what our chart looks like. So as I stated, it goes up in 5% increments from 10 to 20 years. This sliding scale is available online as well as in our annual open enrollment booklet for you to view to become more aware of what the percentage you will be receiving in your insurance allowance. So our members, our option A, B, and C members who retired on or after April 1st, 2012, this sliding scale does apply to you. For our option A and B, I'll discuss option C in just a quick minute, but the sliding scale for the 10 to 20 years does apply to those individuals as well. This allowance can be applied to a city-sponsored plan, or you can enroll into your own privately secured plan as well. And as I stated with the previous group of individuals, the reciprocal time cannot be included, as well as for our classified and unclassified or classified unrepresented individuals that that 5-year purchase will not apply to the health insurance allowance years. And the same for our disability. There is no sliding scale for those individuals if you're on option A and B. Please note that the decision that was made for those individuals who retired after April 1st or retired on or after April 1st, 2012, that it was an irrevocable election that you made, and this decision has already been made. If you have any questions about what option you chose, please feel free to give us a call, SDCERS a call, and we will find out exactly what option you elected. On to our option C individuals. Option C is different from our option A and B who receive an allowance. The option C, once you retire, it's funded and it will go into a trust. When you seek reimbursement, whether for a city-sponsored plan or with a privately secured plan, that request for reimbursement must go through the health trust, not SDCERS. Just want to let you guys know that you have to get the information, and I know Nancy Stadilli is here to talk about option C, and she'll give you instructions on exactly what you need to do to receive the funding from for our option C members. On to my favorite, which is our reimbursements. Our reimbursement process is mainly for those individuals who are on Medicare, if you're on COBRA, or if you're in a privately secured plan, and I'll go through each group individually. So with our Medicare Part B, the options for Medicare vary depending on your retirement date. So if you are pre-1980 individuals, those retired after October 6th, those retired before, for those retired before or prior to October 6, 1980, you're eligible to be reimbursed for your Medicare Part B up to the maximum allowance, which is that $100 per month. If your Part B is less than your maximum allowance, you may receive the difference in as long as you provide sufficient proof to the SDCERS staff, we will reimburse you the remaining. So if your allowance is, let's say, for your Part B about $50, if you provide proof of another expense that is equal to that additional $50, we will give you, we will reimburse you for that $50. And this is the only group that is allowed to apply their allowance to another medical expense. If you retired between October 6, 1980 and March 31st, 2012, you're eligible to be reimbursed 100% of your Medicare Part B in addition to your monthly allowance. So that's pretty awesome. If you're retired on or after April 1st, 2012, which is our option A and B, you may use your monthly health allowance to be reimbursed for your Medicare Part B. And those for option C individuals, as I stated before, you would provide that to be reimbursed, you would have to provide the sufficient proof to your health trust. With all our reimbursements, whether it's privately secured plan or if you're in a COBRA plan or it's Medicare Part B, the deadline for submission of that proof of payment, your proof of coverage, it has to be in by the 10th of every month. That is a very important date. If you provide proof on one day and then you come and provide additional proof after the 10th, you will not be able to be reimbursed until the following payroll. So I just want to stress the importance of getting all proof in by the 10th of every month. Also, we will reimburse back to up to 12 months. So if you provide sufficient proof, retroactively 12 months, we will reimburse for that full 12-month. So our privately secured members, you may be reimbursed. If you decide to go into a plan that's outside of our city-sponsored plans, you do have the ability to be reimbursed for those premium costs only. The deadline, as I stated, is the 10th of every month, and as with the previous slide, you do have the ability to request for reimbursement retroactively 12 months. We do have some members who prefer to submit proof on an annual basis, and we reimburse them a full lump sum for that full 12 months. So depending on how you would like to be reimbursed, we do accommodate those individuals who would like to be reimbursed on an annual basis. So I am so pleased to announce that we have a new process with our COBRA reimbursements. In the past, we would pay the city treasurers of the city of San Diego, and then you would bring your proof and submit proof of that payment to SDCERS. We have now, with collaboration with the city of San Diego, we have now gone away with you having to submit proof to the SDCERS staff. Now all you would have to do is submit proof to the city treasurers, and we will automatically reimburse you. So no need to walk down all the way to 401 West A Street now. We will be able to reimburse you as soon as you make your payment by the 10th to the city treasurers, and that will happen automatically. There is one exception. So when you first enroll as a COBRA member, we're asking you to provide that one-time proof, your receipt, so that we can get you started and into the system, so we can every month thereafter provide you with a reimbursement. As I stated, the payment will go to the treasurer's office by the 10th of every month. And the same with this, if you have retroactively 12 months, we will reimburse you for COBRA payments retroactively for 12 months. So here we have, a lot of times we're getting a proof and you'll get a call, and what we do is we have one courtesy call. We'll provide you with a courtesy call to let you know that the proof that you provided is either insufficient or lacking information. We just wanted to take this time to explain to you all of exactly what we considered sufficient proof and what we consider insufficient proof. If you look over, we have, let's see what my clicker will use. Here we have a check. That's the front and back of a check. So we need the back of the check, which is a canceled check. That is considered sufficient proof. We have a letter from your healthcare provider stating that the payment has been made. We have a receipt from your healthcare provider, as well as a bank statement or a credit card statement or a pay stub will also suffice. This is insufficient proof. This is real. I was like, what? I don't even know what that says there. So here, no, we can't read that. We will give you a call and let you know that we need something a little bit more legible. Also here at the bottom, we need to have the dates. We need to have the name. If you're going to provide the name the very first time and you only want to provide the last 4 digits of your account number, that's perfectly fine. But your very first time of providing proof, please provide your name or a letter that shows your name along with your account number. So every time that you provide proof, we'll be able to cross-reference the name and the account number with the very first initial letter that we received. It's just hard for us to know exactly what months you're paying for, what we're supposed to be reimbursing you for if we have lack of information here. Also, a big one that we have is just the front of a check. We need the canceled check to be considered sufficient proof that it actually went through and the amount that was due was paid. Also, sufficient proof for plan premium rate. This is a very big one. This is only required on an annual basis, but it's very important. We need to know what your premium rate is for each year. unless you're making a change. At that time, you will probably have to provide it more than once a year if you make any changes. But it's important that we need a rate chart explaining to our staff exactly what your premium rate is so that we can properly reimburse you the accurate amount. This is just examples of what healthcare, or what we call a rate chart, looks like. And this is the only proof of premium payment that we will accept. So please note that if you need to speak to whether it's an HR manager or your healthcare provider, we need what we call a rate chart or a premium rate chart. Sufficient proof of coverage. We need an invoice. For those members that are on Medicare, if you're paying into Medicare and you have, you pay into it monthly or quarterly, there is a small invoice that you can look and see, and that'll provide you with your coverage. That's letting us know what months you have been covered and what months we need to reimburse you. So an invoice is very, very important. Also, for proof of payment, we have those individuals who are what we call IRMA. This is Medicare, what we call IRMA. So those are those individuals who have some type of adjustment to their income. Those individuals, it's important that we have the benefit verification letter from you on an annual basis, as well as with those other individuals who are Medicare that receive the benefit verification letter as well. So if you have, I know that in the past we've always said that on that, every November you receive a benefit verification letter, that we need that on an annual basis. But if there are no changes, we ask that we let you know that there's no need to provide that letter. But for the IRMA individuals, those who have an adjusted income, we need that letter every year, regardless if there's a change or not. Those are the only individuals we need that form from on an annual basis. So if you're IRMA, you'll see that you have some type of income adjustment that you have to pay an extra fee for, please provide your benefit verification letter to us every year. Also, if you are covered California, we are trying to emphasize the importance of providing detailed information on your invoice you receive from your healthcare provider if you're on covered California. We need an itemized or a detailed invoice of letting us know exactly what is being paid. There's subsidies, some people qualify for subsidies, sometimes there's fees. So we need as much as detail as possible to be able to reimburse you if you're on a covered California plan. The last slide is to talk about Care Council. So Care Council is an advocacy group, and they help with healthcare assistant program that's available to you all as well as to your continuances. It's a great, great program. I cannot stress enough. They're there to help you. You have healthcare professionals. If you have any questions, if you have any issues, contact Care Council. I have some brochures in the back for you to grab, and it's just giving you information about exactly what they provide. They're providing healthcare education, information, advocacy, coaching. If you have any questions about plans or what doctor you would like to, did they have any special doctors that they're aware of, or noted doctors, they'll be able to give you all this information. Please use Care Council. It's available, it's free, they're there to help you throughout the entire year. So it's just a great program to have, and please use them. So thank you so much for coming again, and if you have any questions, please jot those down on the index cards, and we'll go on with HealthNet. Thank you, guys.
Good morning. Welcome to the Silver Tsunami Party. My name is Kathleen Bryant. I am a senior consultant with HealthNet. I've been with HealthNet for 14 years, but I've been in this industry for 40, and I hope to be joining your club very soon. Co-presenting with me today is Kimberly Shields.
Hi, my name is Kim Shields, and I'm actually the Regional Sales Manager for HealthNet Medicare programs here in San Diego. I've probably met half a dozen of you at least over the years at different presentations and so forth. So if you have any questions specifically on providers in San Diego County, I'd be more than happy to help you with this. And the portion I will talk about today is a Medicare 101. And actually, Kathleen will go over more benefit-specific different programs that we have. So thank you for attending. Back to Kathleen.
Thank you. So our discussion today is going to focus not so much on the detail of the benefits, but the different plans that we offer depending on whether you're an early retiree, a retiree that's over 65 but not entitled or enrolled in Medicare A or B, or you're a retiree that's 65 and you are entitled and enrolled to Medicare Part A and Part B. So for those of you that realized a long time ago that your in-laws are not a retirement plan, and you did the proper planning, and you are now reaping the rewards of early retirement, you will be able to, or you will be entitled to have the same plans and benefits that are offered to active employees. So if you're enrolled in a HealthNet HMO or a HealthNet PPO, the benefits that are provided to the active employees will be the same benefits that would be provided to you. Both the HMO and the PPO plans operate on the same networks that are available to active employees, but please note that if you decide to move out of state and you select the PPO plan, we do use a different network of PPO providers called First Health. For those of you who are retirees over age 65, but for whatever reason you're not entitled or enrolled for Part A or Part B Medicare, the same would be applicable to you as with early retirees. You would be having the benefits that are offered to active employees would also be offered to you. So if you're enrolled in a HealthNet HMO plan or an HMO PPO plan, it would be the same benefits offered to actives and also the same network of providers that are offered to actives. Again, if you move out of state, then the PPO network we use for our out-of-state PPO is through First Health PPO provider network. For those of you that are retirees with Medicare Parts A and B, there are two choices that you have available to you. One is a Medicare Advantage plan. Our product is called Seniority Plus. This plan is available to retirees that reside within our Seniority Plus network service area. If you instead wish to select the Medicare HMO COB plan with a PDB pharmacy benefit, then that would be available to retirees who reside within the HMO COB network service area. Please note that these two different networks can vary from the network that is offered to active employees, so you want to be sure to check the respective networks to determine whether or not your current doctor and medical group participate. For retirees that do not reside in either one of these plans' service area, there is a third choice. It is a Medicare COB plan, but it is a plan that does not have any network requirement. Okay, from here I'm going to turn it over to Kim, and she's going to talk about Medicare 101.
Thank you. So anyway, thank you again. I don't know how many of you have had an overview on Medicare and a Medicare 101, so we're going to do it twice, once with myself and once with Nancy. So I'll get through it and give you some basics on what it is. We're just going to go right into it. The history of Medicare. So for those of you who aren't aware, started in 1965, started offering Medicare benefits. And then in 2003, the biggest addition that happened was the Medicare Part D, which was the drug benefit. I don't know if anyone back in the olden days had Medicare, but there was no pharmacy coverage for individuals until 2003 through the federal government. So that was actually a really huge benefit that's been offered. Medicare is administered through the Centers for Medicare and Medicaid Services. So the mail that you get does say CMS on the outside of the envelope. So for any of you who are applying for Medicare, just make sure that you open the envelope that says CMS on the outside. It doesn't say Medicare, it says CMS. So make sure that you know what CMS is. Medicare actually is for folks who are 65 or older or on permanent disability. There are 4 parts of Medicare. Medicare Part A, which is hospital, Part B, which is medical, and we'll go through these, Part C, which is what we call Medicare Choice Plans or Medicare Advantage Plans, and then the newest addition is Medicare D. So Medicare Part A, most folks who have worked will automatically be entitled to Medicare Part A as long as you have contributed for 10 years in payroll taxes. Hospital insurance on Medicare A would be skilled nursing, hospice, home health. The premium for Part A, if you didn't pay in, okay, or if you didn't work actually long enough, is $407 for those who have less than 30 quarters of Medicare covered employment. For 2015, Medicare A does have a deductible. And when Kathleen talks a little bit later on the different Health Net plans, she'll do a comparison that will show you original Medicare versus what Health Net, Seniority Plus, and our coordination of benefits plans offers. So there is a deductible for Medicare A of $1,260. And if you aren't, there's a late enrollment penalty, and it says right there, if you didn't enroll on Part A when you were eligible, there is a 10% penalty. So that's just something to keep note of. Medicare Part B, doctor visits, labs, medical equipment, wheelchairs, walkers, oxygen. Currently, the Part B premium for Medicare is $104.90. How this works is for most folks, it automatically comes out of your Social Security check. So if you don't currently have Medicare, okay, and you're applying for Medicare, just know as long as you're getting Social Security, it'll come out of your check automatically. If you're not taking Social Security, then you would be billed quarterly, and you can pay those premiums directly. The best way to apply for Medicare Part B, obviously, is 3 months before your birthday. So if your birthday is July 17th, okay, you want to apply 3 months before April, okay? So April 1st, and then your benefits will start on the 1st of the month that you turn 65. Does that make sense? Okay, good. There is a late enrollment penalty also if you do not enroll in Medicare Part B. Medicare Part C are the Medicare Advantage or Medicare Choice Plans. What a Medicare Advantage plan does is it provides all the benefits that traditional Medicare does. So Medicare A, right, hospital, Medicare B, medical, outpatient services, medical supplies. The Medicare Advantage plans are required to offer the same benefits that Medicare offers, but we can also give you enhancements that traditional Medicare does not. They're run by private insurance companies, and Medicare reimburses the health insurance plan that you choose every month. So if you choose a Health Net program, Seniority Plus, the federal government pays Health Net monthly for you to take care of your health care needs. Part D is drugs. So Medicare Part D is also run through private insurance companies. It's the pharmacy component of your health care. It's not automatic. So if you choose a plan that doesn't include a Part D, you'll need to find a Part D. The Health Net Seniority Plus plan that Kathleen will talk about does include a Medicare Part D program. So it incorporates the C plan, which is Seniority Plus in this case, incorporates your Medicare A, hospital, B, medical, C is your plan, and then D is the drug plan. So you have everything under one roof with Health Net. Okay? You cannot be on 2 Part Ds at the same time. So if you're on a Health Net plan and you get a flyer in the mail and it looks like this great program out there and you enroll in another Part D plan, you'd actually get disenrolled from your Health Net plan. So it's important to know that if you're on a Medicare Advantage plan, A, B, C, and D, it's all there for you under one roof. If you don't take a Part D when you're originally eligible, there is a penalty on that, and I'll get through that in a later slide. And there are also some extra help. So if you qualify for extra help, if your income is below the poverty level, there is extra help on prescription drug programs where you can qualify for lower co-payments and co-insurances on your pharmacy benefits. And then the last thing I'll tell you about, it just kind of explains how you're penalized. If you don't take a Medicare D plan when you're eligible, you get penalized 1%, okay, per month for the months that you didn't take it. So on average, for example, if I turned 65 in January of this year and I didn't take a Medicare D, and I decide next January, oh shoot, I wish I would have done that. I wish I would have chosen a plan with a D. I would get penalized for 12 months, okay? So it would be 1% over the months, so it'd be about $3, okay? Which is the average is about 30-some dollars, $33.13. So it'd be $3, whatever, and 33 cents. But every month that you don't take it, then you would have a penalty. Does that make sense? Yes? No? But if you do choose a program, and most of the programs that are available do also include a Part D component, okay? So I'm going to turn it back over to Kathleen, and she's going to talk a little bit more about original Medicare versus what Health Net has. Thank you.
I'm back. Okay, so this next slide illustrates, dovetailing on what Kim just shared with you, when you enroll in a Medicare Advantage plan, what you're doing is you're assigning your Medicare benefits over to the carrier. And in exchange for original Medicare coverage, what you're going to see on the left-hand side of that slide, Health Net will provide you with the same original Medicare benefits plus enhanced benefits as well. So you can see there that original Medicare covers 80%. If you were to retain that only, as opposed to the Medicare Advantage plan that's offered through the city, which includes doctor visits, podiatry visits, and other covered services at a copay. The plan also includes preventive services, and the city has elected to also include chiropractic services. And another bonus is the Silver Sneakers Fitness program that automatically comes with the program. So when should you enroll for Medicare? Now, if you're an active employee and you've decided that you're going to keep on trucking and you're going to work past age 65, you don't necessarily need to enroll in Part B Medicare. You can do so after you retire, and then go down and apply after you have retired. As Kim mentioned, it's normally automatic for Part A. But as Kim can share with you, there are some situations where it's probably safe just to go down and make sure that you're enrolled just in case something gets mixed up. Do you want to comment on that?
Yeah, there really is no rhyme and reason anymore. It used to be an automatic Medicare Part A right when you turn 65. But now with more of the enrollment being done online, they just want to verify that you do want, that you're 65 and that you're getting Part A. So if you're still going to continue to work, I would just actually, it's simple to do, go to Medicare.gov and apply for Medicare A, and they'll probably say you already have it, you don't need to do this, but we have had some circumstances where people have needed to do that. So,
as I mentioned earlier, there's two types of Medicare plans. For those who have both Part Medicare A and B, plans that are available through the city. One is the Medicare Advantage plan, which I've briefly already talked about. The other is the Medicare COB, or Coordination of Benefits plan, with a pharmacy plan. Now, the big difference between the Medicare Advantage plan and the Medicare COB plan is that with the COB plan, you retain your original Medicare. So what happens is when you sign for this plan, you keep Medicare in place. Medicare will be the primary payer, and then the Health Net plan would be the secondary payer. Both plans include pharmacy. Under the Medicare Advantage plan, the pharmacy is interlocking. It's all under one plan. With the Medicare COB, you're going to be enrolling for the medical under one contract, and then the Part D pharmacy under a separate contract. So you'll have two ID cards, one for medical, one for RX, when you select the Medicare COB plan. Benefits to having an employer group policy as opposed to an individual policy. There's no, how many of you are familiar with the term donut hole? Okay, a lot of people have heard that term. There's no donut hole in your prescription drug benefits through an employer group. The plan offers some ancillary products. I know here it says dental and vision. That's not included in the products that we offer, but it does include the chiropractic. There's a richer formulary. How many of you are familiar with the term formulary, pharmacy formularies, which is your list of drugs that you can use? Under a group plan, the list of drugs that you can use is richer than what you could purchase through an individual plan or what we call a street plan. And there's other reasons that as outlined here, why it would be beneficial to you to go with an employer plan versus an individual plan. But you certainly have the freedom to explore both. Additional Medicare programs is the Low Income Subsidy, LIS. If you qualify for that, you may be able to get assistance with paying for your premiums. The annual notice of change, or what we call ANOC letters, approximately 15 days prior to the start of open enrollment. For those of you that are enrolled with HealthNet, you'll be receiving this annual notice of change notifying you about what has changed or not changed under the Medicare Advantage plan. Again, this is just the Medicare Advantage plan, does not apply to early retirees or the Medicare COB plan. For those of you that are enrolled in the Medicare COB plan, you will receive an ANOC notice for the pharmacy plan, the PDP plan. And it's simply a requirement by CMS that we notify you if there are any changes to those benefits. As mentioned earlier, there's going to be a Retiree Help Day on June 17th. HealthNet plans to be here with our representatives. At that Retiree Help Day, we will have materials, have representatives on hand to answer questions, get into the details of the benefits that we offer. So we hope that you'll take advantage and come out and see us on June 17th.
Just to touch on a few topics that they said, just to let you know that you will be disenrolled if you try to enroll into another Part D. If you have Kaiser HealthNet plans that already have a prescription drug coverage, which is Part D included, you will be disenrolled in CMS, and we will, by default, as well as disenroll you. So please, please watch out for those advertising, those companies advertising for additional prescription drug coverage. And now we'll have Kaiser.
This one right there, endpoint. Good morning, everybody. It's still good morning. Thank you for having us here. My name is Charlotte Souza. I'm with Kaiser Permanente, and I've been an employee of Kaiser for the last 21 years, also a member of Kaiser, and I have Kaiser babies and a grandbaby that's Kaiser last year. Very proud of my baby. The presentation I'm about to give you is an overview about your Kaiser Permanente plan, and then I'm going to touch upon the benefit for the early retirees. And then we're going to hand it over to Nancy Voltero, your retiree consultant, to touch upon the Senior Advantage for the Medicare portion. And Michelle Knapp, my colleague here, she's your associate account manager. She's your expert on your products here. Okay, so what I'm going to cover is talk about the Kaiser Permanente doctors, the facilities, your personalized care, round-the-clock access, your wellness tools and resources, and of course our state-of-the-art electronic medical record. As you know, when you sign up with Kaiser, we encourage you to establish with your physician. Don't forget, you can always change physicians anytime and as many times as you want. You can go on kp.org or call member services, and you can find out what schools they went to, how long they've been with Kaiser, what are their areas of expertise, and so much more. Again, these doctors came from the best schools all over the country, such as Harvard, UC Davis, Stanford, and they come in to practice medicine. They're here for you and take care of you as a patient. Our facilities in California, we have other facilities outside of California, but in California we have 170 locations throughout the state of California. Here in San Diego, about 20 of them. And most of these facilities have everything you would need. A primary care division filled with family doctors and internists, laboratory, pharmacy, and x-ray, all in one building, so you can take care of all your needs in one place. Again, you can access other locations if you need to, but we want to have the convenience there for you in one single trip. And don't forget, in the middle of the night, if you don't know what to do, you have the advice nurse line that can assist your care. You are covered for emergencies anywhere in the world. And if it's not an emergency, but it's an urgent need, we do have urgent care facilities throughout the area. Our very advanced electronic medical record, many of you are aware of this, has provided less duplication. You don't have to be repeating tests as a member, less errors, of course. And with that, a program called My Health Manager has been created for you. So if you register on a secured site, you have access to part of that electronic medical record. You can communicate with your doctor online. You can see your lab work results. You can also order prescription refills and have it mailed to your home. Save some time and money from having to go to the pharmacy. You can book your own appointments, and you can access the past history of your appointment. So if you forgot what your doctor instructed you to do, you can always access that care instruction sheet on the website. And then again, if you use a mobile access, you have a phone, Android, iPhone, any web browser, you have those capabilities on your phone, and a lot of us use that now. And I travel a lot, so I use that a lot. And I send messages to my doctor, I order prescription refills, it makes it very, very easy for me. I just want to give you one example, which I have many, but I'm going to give you one example, is my son, he plays travel baseball, he's a catcher. He got hit pretty hard on the left hand, and I emailed his pediatrician. He responded back saying, I said, I'm very concerned, I hope it's not broken, his hand. And he responded by, just let me know if it's the right arm or the left arm, and I'll send the instructions to the x-rays. So without seeing him, I went straight to the x-ray room, and he had his test done, came back, he emailed me, he's fine. So just, again, save yourself some time and money and take advantage of the technology that's there for you. There's the app. So download the app and you'll have access to all kinds of information. Oh yes, a couple of years ago we also added a feature called the Personal Action Plan. What that is, it tells you what preventive services are due in the future. Any kind of cancer screenings, mammograms, pap smears. If you have diabetes, cholesterol, it tells you when it's due. That way it reminds you. And also it date stamps it for you. So look out for that feature. It helps you be on top of your care. And then this is just a sample of what the website looks like. Lots of great stuff, health education information, 8,000 healthy cooking recipes, and so much more. And then take care of yourself, not just when you are sick, but also when you are healthy. We have telephone coaching on stress reduction, smoking cessation, weight reduction, nutrition, fitness. There's telephone coaching. You make the appointment over the phone. You don't have to pay anything. There's also web-based lifestyle coaching, as well as, of course, your health education classes you can attend. All of this is part of your benefit, so take advantage of it. You do have discounts for acupuncture, massage therapy, and chiropractic. Of course, you have the chiropractic benefit as well. We have a very rich rider added to your plan, a $15 copay for your chiropractic care, so don't forget that. And these are some samples of the preventive services that I mentioned. Oh, some updates. We built a new facility. I mentioned we have 20 facilities, but Carmel Valley off of Highway 56, a brand new facility. You have an option. There's another one in Oceanside we just added, twice as big as the older one. It was opened last year in March. And then, of course, we added the surgery center in San Marcos, as well as, don't forget, we have the Garfield one. Beautiful facilities here in San Diego for you. And then we partner, for those of you who may live in North County, we partner with Palomar Hospital, and our members are hospitalized there should they need to be hospitalized for surgeries, whatever hospitalization may need. Of course, any emergencies, you're covered anywhere. And then some of you may have seen this already, but if you drive on Highway 15 in Kearney Mesa area, you'll see off of Claremont Mesa Boulevard a beautiful building being built. That's going to be the brand new Kaiser Hospital, scheduled to open on 2017. So it's coming up soon, and it's going fast. So heads up for those of you who are members of Kaiser. In the last few months, we have partnered with Target. Only 2 stores here in San Diego, one in Mission Valley, the one in Mission Valley, and the one in Vista. And with your copay, you can see a physician there, and for minor illnesses, minor injuries, And it's staffed by Kaiser physicians or physician's assistants or nurse practitioners. And they'll take care of you. If they give you a prescription, you can use the pharmacy there at that time. Any refills after that, you will have to go to Kaiser. But just an added option for you, they're available on the weekends and up to, I think, 7 o'clock in the evenings as well. So just an added benefit for you. I know they're targeting El Cajon, Santee area too. More to come on that in the fall. And then last but not least, your benefits. These are, again, your early retirees. You do not Medicare. Very quick, rich benefits for you. $15 copay to see your doctor, whether it's a specialist or urgent care. Your x-rays are 100% covered. Your surgeries are at $50. And if you're hospitalized, $100 copay, regardless of the length of time that you're there. Okay, your medications. Generic medications are at $15. And then your brand medications are at $30. Very straightforward. You get 30-day supply, but if you do it by mail, again, do it on your phone or your computer, order it. And with 2 copays, you get a 100-day supply for your maintenance medication. Okay, these are your high blood pressure medication, birth control pills. So chiropractic, again, you have that benefit, rich benefit. Take advantage of those benefits. And again, thank you for your time, and we'll go to the next presentation.
I just wanted to say that if you did have any questions, please jot those down and please hand those to the SDCERS staff to collect it, so we'll be ready for those questions.
Okay.
It's going to be Charlotte again.
I thought we were going to take turns. Okay, so what this is just an awareness for you. A couple of years ago, I got certified as a plan-based enroller for Covered California. So I represent the Kaiser portion. So again, it's generic information. It's geared more towards the people that are uninsured, but it's just an awareness for you. So we're just touching upon that. And again, write your questions down, and we'll be happy to address them later on. So your guide to healthcare reform. So what we're going to talk about is healthcare reform, your top 5 no facts, peace of mind, and the marketplace, which is also known as Covered California, financial help from the government, and we'll discuss that, and then some terms you should know, and I think you're familiar with those. This is very basic. Again, it's for the uninsured, so you may already be familiar with a lot of this. So back in 2010, March 23, the Affordable Care Act came to place. Some people call it Obamacare. The proper term is Affordable Care Act, ACA. So we have 3 pockets. The insured person, which is you and myself, covered by your employer. Then we have folks that are covered directly through a health plan. They have individual plans. And then the last is the uninsured, and that's the one that we're talking about. And then they're counting folks that are U.S. citizens and that live here in the country legally. So what is healthcare reform? It refers to the Affordable Care Act, again, geared towards your receiving medical care. Who has to buy health insurance? Basically, everyone. For those that are uninsured would go to Covered California for details, but now we have the exchange. And then what if you don't buy health insurance? And as many of you may know, there will be a penalty. 2014 was the first year that they're applying a penalty for those that are uninsured. It does say that if you are covered 9 months or more, you're fine. So you have a couple of 3 consecutive months that you don't have to be covered with Covered California. So what if I can't afford health insurance? So if you go through Covered California, they have financial help. Again, these are folks that don't have insurance available to them. What services do the new health plans cover? Basically, anything that's medically necessary. Emergencies, mental health services, prescriptions, all the basic services are available. And the peace of mind. What happened also with most health plans, including the employer plans, is that the lifetime limits have been lifted. So there's no more limits for the types of health plans that had a limit. So if somebody had cancer or whatever, they don't have to worry about that they're going to reach a certain amount and not be covered anymore. So that is no longer a problem. And then people with pre-existing conditions can now get coverage. And then, of course, children, your dependents can now be covered up until age 26, whether they go to school or not, whether they're married or they live at home. So that's a new thing as well. And that's probably, it's been going on since 3-4 years ago. And of course, the pre-existing condition is no longer an issue with any of the plans. So this is the pre-existing condition. No worries, you can go from one plan to another should you want to. No longer worry about whether you have a pre-existing condition. So the covered California plans, they have 4 levels of coverage. Not just with Kaiser, but there's like around 8 other health plans out there that are part of that covered California. There's a bronze, a silver, a gold, and the platinum. So the richer the metal, the richer the benefits, which means a little bit more expensive. Most of these plans do have the high deductible. There's a very high deductible to meet before the benefits start working. Okay? And then, of course, there's the other piece. Those that have Medicaid, in California, it's Medi-Cal, and Medicare, that's separate. And then the financial assistance, which is the subsidies for the covered California people, which is separate. Okay, so the employers, the folks such as ourselves that are covered through our employer, we just continue as we go because we're not affected as much. It's mostly the uninsured. The people that are covered individually, such as your neighbors, maybe family members or friends, if they have an individual plan, let them know to go to Covered California and see if they qualify for those subsidies. They may get a discount. And then, of course, the uninsured. Definitely go to Covered California if you want to get the added help. And then there's a lot of plans that are offered individually outside of Covered California, but if they want to get the financial assistance, they do need to apply through the Covered California Exchange. And I was noticing on your agenda, it does have the website. So if you are curious about what's in there, you're welcome to go to that website as well. And then the terms, this is what you are familiar with, but someone that has been uninsured for many years may not be familiar with this. And of course, it's the co-insurance. If you have a co-insurance type of plan, you would be paying a percentage. If it's a co-payment, it's a fixed dollar amount, which you have here through the city of San Diego. And then the deductible. This means that you're responsible for the first portion, and then your benefits start working. And then there's several plans, companies that have like a grandfathered status. That's what they chose. And then, of course, the health insurance marketplace is Covered California. Out-of-pocket expenses, these are your co-pays, your co-insurance, your deductibles, anything that you pay at the time of service, that would be an out-of-pocket expense. And then, of course, the premium, that's what you pay on a monthly basis. Keep in mind, we're presenting to an uninsured market, so this is for that. So you're familiar with this already. So again, write your questions down, and then we'll be happy to address them afterwards. I'm going to go ahead and turn it over to my colleague, Nancy Voltero. She's our retiree consultant to talk to you about Medicare. Thank you.
Thanks, Charlotte. Well, good morning, everyone. Good morning. I'm Nancy Voltero from Kaiser Permanente, and Kim Shields has already hit on Medicare 101, but we're going to do it again because there's a lot to Medicare, so maybe there's some things you might have missed, and maybe we can expand on a few things. So we're going to do a Medicare 101 again. So if we can go to the next slide, we're going to jump right into the basics of Medicare. All right, so as Kim said, Medicare is a federally funded program. So when you get your Medicare and it has your card and you have, it's going to say Part A hospitalization, Part B medical, you have an 80-20 plan. So Medicare pays 80% of the claim and you pay 20% of the claim. The problem is you don't know what 20% of the claim is going to be until you actually get the bill in the mail. So a little challenging with that. But Medicare's been around a long time. It's been around since 1965, and it actually came in under President Lyndon Johnson. And we talked about Medicare being administered by CMS, so that's Centers for Medicare and Medicaid. So when you hear that term, that's exactly what we're referring to. Okay, so who's eligible for Medicare? There's actually 4 groups of people that are eligible. The first group is going to be anyone turning 65 years old. And right now, us baby boomers are turning that magic age. So statistics are, nationwide, we have 10,000 people a day turning 65 years old. And that will be for the next 18 years. We've already had 2 years of that. So Medicare is going to be pretty busy. The next group is anyone under 65 that has a disability and they've been on Social Security disability for 2 years. They qualify for Medicare A and B. And the third group is anyone that's been diagnosed with end-stage renal disease, which is complete kidney failure. So once somebody goes on dialysis, they're usually eligible for Medicare probably the first 4 months of being on dialysis. So it's pretty quick. And there's only one other disease that qualifies for Medicare A and B, and that's Lou Gehrig's disease. So if anyone does have that, they'll be eligible for Medicare A and B right away, okay? Okay, so let's hit on Part A again. So Part A is going to be your inpatient services. So it's going to cover hospital, skilled nursing, home health care, and hospice. So those are the benefits that are covered under Part A, so think of them as inpatient services. Your eligibility is the first day of the month that you turn 65 years old. Unless you are born on the first of the month, then it goes to the month before. But even if your birthday is on the 30th, it'll still be the first of the month. We talked about 2 years after being disabled and right after kidney dialysis begins. So what's the cost of Medicare Part A? As Kim said, for most of us that have paid into Medicare, Part A is not going to have a premium because we've already paid into Part A, so our Part A premium is going to have no charge. If you have less than 40 quarters, which is 10 years of paying into Medicare, CMS will let you know exactly what you would pay for Part A if you don't have those 40 quarters paid in. So you may want to check with Medicare. Part B is going to be all of your outpatient services. So this is going to cover outpatient surgery, it's going to cover your doctor visits, it's going to cover even dialysis. So anything that we do on an outpatient basis, which is going to be most of the time, is going to be covered under Part B of Medicare. So how do you enroll in Part B? Well, the easiest way to do it now is to go to the Social Security website and sign up for Part A and B on the website. With 10,000 people a day turning 65, this is going to be the easiest way to get enrolled. Now, enrolling, this is where it gets a little tricky. Now, if you, as mentioned earlier, if you are still working, you do not have to apply for Part B, as long as you are working and covered on an active plan. You do not have to take Part B. If you are retired, you have a 7-month period to apply for Part B, which is 3 months before your birthday month, and 3 months after your birthday. If you don't enroll within those 7 months, you're going to get a penalty, the late enrollment penalty. And we don't want you to get the late enrollment penalty because that penalty stays with you for as long as you're on Medicare, which means that penalty will stay with you the rest of your life. So this isn't a one-time penalty. So the cost, let's skip the cost for a second. So there's the penalty right there. The premium goes up 10% for every 12 months that you decline coverage into Part B, and that's known as LEP, which is late enrollment penalty. And you'll see not imposed if you continue to work for a trust or a company or a city that has more than 20 eligibles. So you would not be assessed that penalty. So the cost of Part B, if you're collecting Social Security, that Part B premium is going to come out of your check automatically. You don't have to worry about it. If you are not collecting Social Security, you are going to be billed either on a monthly or a quarterly basis. So you want to make sure you pay those premiums so you don't get disenrolled from Part B. Okay? Now, the Part B premium ranges, and this changed quite a while ago. And here's the chart for Part B. So when you apply for Part B, what Medicare is looking at is they're looking at your modified adjusted gross income for the 2 years before you retire. So right now they're looking at 2013 and 2014. They're looking at your taxes for your modified adjusted gross income. So you'll see the premiums range anywhere from $104 a month all the way up to $335. So again, it depends on your taxes. But most people are going to be paying the minimum, which is the $104.90 per month. So if you're single and your adjusted gross income is less than $85,000, or if you're married and your adjusted gross income is less than $170,000, you will be paying that $104.90 per month. Now, if for some reason you're making more money than that right now, you work till 65 or 66, and your income is above that, does that mean that you're going to be paying that higher premium forever? No, because what Medicare does is they look at your adjusted gross income yearly, and if your income goes down, which most of the time it does once we retire, they will take a look at that again, and you'll be adjusted down. But keep in mind, you can be adjusted up as well. So if your income goes up for some reason, they can go up on your premium. So they'll let you know what your Part B premium is when you apply for Medicare. Okay, how to enroll in Part B, we hit on this. You can make an appointment to go in and talk to somebody at Social Security. You can call them on the phone and they will actually enroll you over the telephone. Or the easiest way is to go online. You go to the Social Security website and apply online, and it takes about 15 minutes to fill in your information. So it's a really easy process to do. Okay, so now we're going to talk about Part C, which we talked about a little bit earlier. So once you get your Medicare Part A and B in the mail, you're going to get a red, white, and blue card. You now have a choice to sign up for whatever plan you want to sign up for. So you can stay with the city-sponsored plans, you can go out on your own, you can stay with Original Medicare. But if you take a Part C plan, which is a Medicare Advantage plan, you are taking your Medicare and you are assigning it to whatever company you decide to enroll with. So that's Medicare Part C. Okay? So you can go with an HMO, you can go with the PPO. Private fee-for-service we don't see anymore, and we hardly ever see a medical savings account. Most of the time it's going to be an HMO or a PPO that you are assigning your Medicare to that company. Okay, Part D is the drug plan, and we talked about that a little bit. In 2006, it came in 2003, but it actually didn't roll out until 2006. So this is your enrollment in the drug plan. So just to let you know that if you take the Kaiser Senior Advantage Plan through the city, you have Part D already. So like Kim said, don't sign up for another drug plan, because if you do, you are going to get disenrolled in your health plan. So Part D, I think we saw a show of hands for who knows about the donut hole? Okay, a little bit. All right, so if you stay with the city and you go on to either one of the Senior Advantage plans, you've got the best plan because it doesn't have the donut hole. All of the individual plans that, when you turn 65, how much mail are you going to get? Okay, about that much. Those plans are individual plans, and Kaiser has an individual plan as well as HealthNet does. All of those plans are subject to the donut hole that came in 2006. So the donut hole is going away, but it won't go away until 2020. So as I said, your best benefits, your richest benefits are always going to be on a group plan because you folks are the only ones that qualify for the group plan through the city. The individual plans is what we call the street plans, which means anyone can enroll in the individual plans. But you have a great plan through Kaiser and a great plan through HealthNet to choose from. So that's the Part D of Medicare. If you know anyone that's been in the donut hole, it is not a good place to be. It is getting better. Previously, when you get in the donut hole, you paid 100% of your medicine. Now with the Affordable Care Act, the pharmaceutical companies are paying 55% and you would pay 45%. But if you're on a drug that's $1,000 a month, that's $450 a month out of your pocket. So again, a no donut hole with the Senior Advantage plans through the city. Kim touched on this, enrolling in Part D. Same problem as Part B. If you don't enroll in those 7 months, you're going to get another penalty, and that is 1% per month for every month you don't enroll. Just like Part B is 10% for every 12 months you don't enroll in Part B. So we don't want you to get those penalties because they do stay with you for as long as you're on Medicare. Extra help, I think we hit on this. If you have limited assets or income, there is extra help, and your prescriptions could be as low as $1 if you qualify. There is a form to fill out. It's a Social Security form. On the opposite end, and I think Mia touched on this earlier, this is IRMA, Income-Related Medical Adjustment. So if you fall into the Part B premiums that are $104 a month, which means your income is less than $85,000 as a single person and $170 as a married person, this will not apply. This is for incomes that are over $85,000 and over $170,000. If you get a bill in the mail for Part D, now keep in mind, if you're collecting Social Security, they're going to take that premium out automatically. But if you are getting a bill and in your mind you're thinking, I already have Part D, why should I pay another premium for Part D? This has nothing to do with the insurance that you have. This is because of your income. So this is income related only. So you'll see that the smallest premium is $12.30 and it goes up to $70.80 a month. If you do not pay this premium to Medicare, after 90 days of not paying, they send over a tape to whatever insurance company you're insured with, and they say, Mr. Jones did not pay for his Part D, disenroll him from your plan. So you will get disenrolled from your plan if you do not pay this Part D. So just be aware of that. If you're a higher income earner, you will get a bill for Part D. Medicare started rating the Medicare plans about 3 or 4 years ago. I guess since 2012, they've become public. And so these are the ratings for the Kaiser plan, the Medicare plan. So you'll see that all of our regions in the country, we're only in 7, 1, 2, 3, 4, 7. We all have a 5-star rated plan. Georgia had a 5-star last year, and they fell down to 4.5 stars. So hopefully they'll get their 5-star rating back. And just to let you know, Kaiser is the only plan in California, medical plan, that has a 5-star rating, and we've had that since 2012. So we're really proud of that because this is a CMS rating. It doesn't come from a third party. This is coming straight from CMS. Senior Advantage, once you enroll in a plan and you assign your Medicare to a company, you must stay within whatever provider you sign up for. So for instance, in Kaiser, once you sign up with Kaiser, just like if you're on Kaiser now on the active plan, you stay within the Kaiser networks, you use Kaiser hospitals, unless it's an emergency. You're covered anywhere in the world for urgent care and emergency care. So once you assign your Medicare to us, we don't want you to go outside of Kaiser without a referral, or if it isn't an emergency, because if you use your Medicare card on your own, guess who gets to pay that bill? You do, 100%. So make sure you don't go outside of whatever company you signed up with, okay? And this is just contact information. We did have some Medicare guides. I don't think we have enough for everyone, but there are some Medicare guides out there, and these are the phone numbers for Kaiser as well as Social Security and Medicare. Okay? So I'm going to turn it over to Nancy.
So you'll also receive a packet from SDCERS, just in case you forget you're turning 65. We send you a nice reminder in a packet to let you know how to prepare and what plans are available to you once you turn 65. And lastly, we'll have Nancy Stadilli from the Risk Management Department with the City of San Diego.
Good morning. Everybody getting a little numb on the bottom by this point? All right, we'll move this along, but I want to make sure we cover everything so we can get your questions hopefully answered. So those of you who were here before April 1st of 2012 and retired after April 1st of 2012 know that the city changed and asked you to make a irrevocable selection for either options A, B, or C. That's what I'm going to be covering first. So on April 1st, you made a decision or before April 1st, you made a decision whether you wanted A, B, or C. So talking about A and B are both defined benefit contributions, which means it's a set amount that you can use the city's plans and have those deducted from your SDCERS check on a monthly basis. If you became a deferred member after you made your selection and you had selected option A or B, and there's no longer that payment coming out of your check every month, you default to option C. So hopefully you all know where you are, but you did make that election, and it was an irrevocable election. So for option B, again, same thing, you made that selection, and if you did not continue having a paycheck with the city, in other words, you left knowing you were eligible to receive it, retiree health, but you no longer had that deduction coming out of your paycheck, you defaulted to option C. And option C is a defined contribution plan, which means that based on your years of service with the city, your age, whether you are a safety member or a general member, and whether you are male or female, there was a set amount set aside for where you fit in those categories. And once you became eligible, that money is put into an account, a health savings account that is there for you for the length of your retirement. And the one thing to remember is, I'm looking to see if it's on this slide, I'm probably skipping slides, is that reciprocal service does not count towards your option C. So whatever years of service you had with the city is what your option C amount will be. Okay, so for option A, the current yearly annual amount that is reimbursable is $9,426 for the fiscal year 2016. So that's about $785 per month. And your option A does increase 2% per year for your reimbursement for your premiums. And so SDCERS is the one who tracks your service. So if you think, you know, I should have, and it is prorated, so if you had less than 20 years with the city, you may not get that full amount. It is prorated. And SDCERS does track your service time. And again, as I said, reciprocity is not available. And so your contribution that you had taken or are currently having taken from your paycheck is $32.11 every pay period, and that is on a post-tax basis, and that started back in 2012. And again, these contributions are irrevocable and continue as long as you're receiving a paycheck from the city. And option B, basically same information, except their amount is $5,500 per year, and that does not change and does not go up. That's what it will be during the length of your retirement. And while you were an active employee, you did have a contribution coming out of your check of $16.05 each pay period. And again, that continued as long as you were an active employee. And if you left city employment while you had option A or option B and ceased receiving a check, but then were a deferred vested, you became an option C. And again, option B also is prorated based on your years of service, anything less than 20 years. All right, so again, highlighting the main things with option A and B. They are a defined benefit, so they are set at what they are. They reimburse your medical insurance premium up to the maximum amount each month. And costs that are not eligible for reimbursement under options A and B would be dependent coverage, your annual deductibles, co-pays, prescriptions, Medicare Part D, and specialty insurance such as dental, vision, cancer, etc. One more on option A and B. If you are enrolled in a city-sponsored health plan, it will be embraced. You have to get your reimbursement information if you're not going through a city plan in a timely manner to SDCERS no later than the 10th of each month. All right, so defined contribution option C. There were no contributions to this, so there was nothing coming out of your paycheck if you were option C. And once you became eligible based on your age and years of service, the city funded you. And again, that funding was based on age, city service, your years of service with the city, your member status, general or safety. And again, with option C, reciprocity is not an option. It's only your city time that is counted. And there were funding tables. If you're wondering why you got the amount you got or thought you were eligible for a different amount, those tables are actually eligible as part of the Muni Code, the Municipal Code, and that's Chapter 2, Article 9, Division 1. And so once your eligibility is met, the city does have 60 days to fund. And usually it's funded less than that amount, but with the feeds by computer that go from one to the other, we get the information from SDCERS. Once someone is eligible, the city then sends the money to the particular company that is managing your trust account. And so make sure you keep your address up to date if you have not yet been funded, because we send the enrollment packet to your address on record. So if you do have questions and think you were eligible, you haven't heard anything, please contact us at Risk Management at 619-236-6549. And it's called a health retirement account, or you're familiar with like a health savings account. And so there's certain things that are eligible for reimbursements, and medical, dental, insurance premiums are all payable through your health service account, and premiums that you receive a subsidy for through Covered California are not eligible. Now, that doesn't mean that Covered California is not eligible, but if you are receiving a subsidy, then you cannot submit that for a double reimbursement. And again, medical, dental, vision can be submitted. Generally, the advice that I tend to tell people is the average amount, when they did the actuarial numbers for payment, they looked at, given the age you were funded, the average length of time that you probably would live beyond your retirement, beyond your funding, and calculated $8,800 per year for that. So what I tell people is, yeah, you can submit your dental, your vision, and a lot of other co-pays and prescriptions and things, but the quicker you use that up when you first retire, you may find yourself a little short on the other end. Nobody has a formula how long they're going to live, so we don't know how long this has to stretch out. So keep that in mind when you're submitting your premiums for payment. All right, so COBRA, we've discussed that a little bit today, but going into just a wee bit more detail for those of you who have retired recently, within the last month or so, and you're looking for your COBRA packet. Risk Management will mail you your COBRA packet, when that is received, when the termination date is received in risk management. So it has to come from your department to personnel to enter into our SAP system, and then we can see that, we get that notice, and then we get your packet sent out. But if you're not seeing your packet, if you're starting to get a little nervous, feel free to give us a call. And after you get that packet, make sure you get that enrollment form submitted to risk management quickly. Fill that out, get that in, so make sure that there's no break in service. And include your first check with that enrollment form. And that will definitely keep things rolling for you. And as Mia also said, make sure you get those in by the 10th of the month to keep your COBRA rolling. Along with your COBRA packet, there will be information to continue your life insurance, and that does need to be submitted directly to Hartford. All right, so how do you manage it during open enrollment? Well, the city, risk management, will mail you an open enrollment packet, and you should be getting that during the first week in June. And enclosed, you will find a letter regarding any upcoming changes, an enrollment change form, and the premium rate sheet for the next fiscal year. So complete that form and send that in to us for any changes you would like to make. If you do not send an enrollment change form in, everything will remain the same, and if you're not requesting any change, you do not need to send that enrollment form in. So how about CalCOBRA? How do I transition to CalCOBRA from COBRA with the city? Well, about 8 to 10 weeks before your regular COBRA with the city ends, you should receive a CalCOBRA packet from your individual provider, your medical provider. If you do not get that package, you need to contact your medical provider directly in order to transfer over to the CalCOBRA. And to be eligible for the CalCOBRA, there could not have been any lapse in coverage while you were on the regular COBRA. And CalCOBRA is medical only. So if you had your dental and vision through your COBRA with the city, those do not transition to CalCOBRA. And I think we're at the end. I did have a couple of questions that have been submitted that I wanted to address, and one of them was regarding our dental insurance, whether we were going to have any more complete dental plan. Actually, we are just wrapping up an RFP for our dental, and we always look at the providers throughout our San Diego area that are available, as well as what services are being offered, at what cost, and then of course premium costs. So all of those things are rolled in when we're looking at coverage. And so we are wrapping up that RFP, but we tend to use what we are currently providing as our benchmark. We could potentially go to more services, more things covered, but it's going to impact your premiums, as well as maybe this will now be covered, but this won't. And it's kind of a hard juggling act when you're really trying to weigh everything. So we really try to look at the basic services and continue to keep those pretty much the same. The next question, and I think this was an important one, was if you have covered California, let's say you enrolled in Covered California and you are not receiving a subsidy, but you would like to change to one of the city health-sponsored plans, you can do that. You can cancel your Covered California coverage, and that is a qualifying event which would allow you to enroll in the city's program. So with that, I am going to wrap this up, and Mia, is it you or Cynthia? Cynthia. So Cynthia's back. Thank you very much.
Thank you, Nancy. All right, just a few more things, and we'll be wrapping up here. Thanks, everyone, for the attention. I appreciate there's a lot of information to absorb today. And we recognize that when you're reading, when you're listening, when you're going out later and think of something else, there is just a lot of information that you're trying to remember, trying to think of where you need to go to get those next answers. So I want to just remind you that this presentation will be posted on our website coming up soon as we get the edited version back, and we will have this on our website where you can see the PowerPoints that would actually be embedded into the video. It won't be a picture of the PowerPoint from afar, but it'll be a clear picture of the PowerPoint, and then you'll hear the presentations going on behind that. So absolutely a great tool for you to be able to review if you had any trouble seeing something today, or if there was a particular part that you wanted to review. We recorded it specifically so that you could review it again, or if you had other friends who weren't able to make it today. So please use that to your advantage. Also, as we do every year, we will be mailing you a booklet that covers everything that you need to know for open enrollment, that will give you the overview of the rates and the allowances and the coverage that is available. And it will also direct you to a couple of websites if you have much more detailed information. We tried to find the balance between sending out a booklet that used to be too overwhelming to people with too much information, but wanting to make sure that you have it all. And then we have a great deal of information that is on our website. For some reason you don't have a computer or the internet available to you, just give us a call and we would mail that information out to you. And as always, we will have our staff available during open enrollment to answer your questions from 8 to 5 every day, where you can ask specific questions that you may have. Now, I did gather and review the questions that were passed out here, and we're going to cover several of them. One of the important things that I noted with these questions is that much of the information is in the materials that are already published. You just have to know where to look for it, and that's what we want to make sure that we're directing you to. So we're trying to make sure that it's clear how you find those sections within the information that we provide. But additionally, these questions also were helpful in looking at what type of frequently asked question documents that we can provide. For example, on Medicare or on moving out of state. So this was very helpful to us in seeing what we can add to our offerings this year. So I'm going to go through just a few of these, and we have a couple other answers over here that we'll share from our providers as well. And we'll see if the people who wrote these questions already left. So thank you for being here. One person was asking if they are retiring in July, do they enroll during open enrollment? No. People certainly retire all year long, and during your counseling session with SDCERS, we will cover your health care options, and whenever you retire, you can, when you retire that one time, you will be able to enroll in your insurance at that time. So the open enrollment is for folks who are already retired and wanting to make a change. Okay? Yeah, but make it really quick.
So if you retire, let's say July 15th, you retire, you're retiring soon? Oh, congratulations! Yay! I have a long time before I retire. Okay, she just told me not to take it too long. But you will have the remaining of July with your, as an active member, the same insurance, and then beginning in August, that's when your insurance will begin with SDCERS. Okay. Sorry.
Thank you, Mia. Another question that was asked was regarding when you taxes regarding your charges that you make towards your premiums. So when you see your pension paycheck from the city, if you have a city-sponsored plan, you'll see that deduction is made post-tax, and the question was why? And the answer is the IRS tax code. So SDCERS has on staff a compliance officer, and everything that we do is in strict compliance with the IRS. You may remember that when you were an active employee, if you used the city plan, that it would be deducted on a pre-tax basis, and that is what the code calls for. That as an active employee using a city-sponsored cafeteria plan, it's pre-tax. Once you retire, it is always going to be post-tax, except in a very small carve-out for safety members who can deduct a portion. But in general, your healthcare premiums are required to be deducted on a post-tax basis. All right, another question was, if you retire and are using a plan that is through Covered California, can you be reimbursed? And that is through our reimbursement process. A Covered California plan is just like if you were using Blue Cross or Blue Shield or something else that's out there. Just review the reimbursement materials, and if you have any questions, give us a call, and you'll submit that through the usual reimbursement process. Another question was why, it's a good question, Mia, why is so much coverage, or why is so much proof required for my COBRA payments? Mia discussed how we're trying to ease the requirements. We don't want you to jump through any bureaucratic red tape, but the San Diego Municipal Code calls for specific proof that must be required in order to be reimbursed, and we want to make sure that we're reimbursing you the proper amount, and unfortunately some people do try to get a little extra out of there. So we are just complying with what the code says. And if you have any questions about what you need to turn in, please just let us know, and we'll make sure that you know what information to turn in going forward. And another question was, does the city cover insurance for veterans? The city covers the insurance as called out by your retirement date. So as Mia discussed, if you retired before 1980, there's a certain tier. If you retired from 1980 to 2009, there's another tier, and then for the dates going forth. So if you're using city-sponsored plan or a reimbursement, then it would be whatever that set amount is. Another example, if you were a veteran who's perhaps using a Tri-City medical plan or one of the ones that the Navy or something uses, you could submit that as a reimbursement if that fit in, but we would need to look at your specific situation, okay? And now we're gonna cover it, I'm gonna first turn it over to Nancy, and we'll cover just a couple more questions and then we'll be done. Thank you.
Okay, it looks like we have a question about how does currently working affect Part B if you are a city retiree who has a full-time job or a business? So if you are a retiree and you are working for a company that has less than 20 people, or you start your own business and you have less than 20 people, you must apply for Part B, otherwise you will get that penalty, and we don't want you to get that penalty, okay? Second question was, are there any plans available for those who live in two places? With the Senior Advantage plans, you are covered, with Kaiser, you are covered for 6 months out of area. But keep in mind, during those 6 months out of area, you are only covered for emergencies and urgent care. So if you wanted to go in and have a physical or something like that, you must come back to San Diego. So because we are a PPO, we're an HMO, we really don't have where you can be covered in two places at one time. So I'm going to defer that over to HealthNet.
We got several questions that are all basically the same, and they're questions about the network relating to Sharp Scripts and UCSD. I'll take the Sharp Scripts first because that's an easy one. As far as the HealthNet Medicare COB plan, the COB plan HMO network does include Sharp Scripts. By the way, I did bring, it's a limited supply, but I did bring a supply of the COB medical groups that do participate. And my associate Paul, who's sitting over there in front of the doors, he's standing and waving. If you would like a copy of that, you can see him. Again, this is just for the HealthNet Medicare COB plan. And it lists all the medical groups in San Diego County that do participate. Now for UCSD, there were several questions with respect to that medical group. One of the questions was why are they no longer participating? Will they participate in the future? Things of that nature. I don't know the why of why that medical group left HealthNet's Seniority Plus plan. And unfortunately, those specifics are not shared with us through our provider contracting department. What I can tell you is at this time, I don't know of any plans for them to come back into the Seniority Plus network, nor do they participate in the HealthNet Medicare COB plan. However, on the COB plan, as I mentioned earlier in my presentation, that is a plan where you keep your Medicare as primary. So if you do see a medical group or a doctor that's not within HealthNet's HMO COB plan, you can still receive reimbursement through Medicare. You would just be responsible for the Medicare deductibles and coinsurance if you chose to go that route. Also, correct me if I'm wrong, USD does participate on the individual Medicare supplement plans, which that's different from the COB plan, and that is a individual plan or street plan. And I think that was the question surrounding the two provider groups. The next question was, how does HealthNet flex? And I'm assuming we're talking about the Flex Med, which is also a COB plan for those retirees who do not reside in a Seniority Plus or a Medicare COB network. That the question is, how does that work for out-of-country or state travel? The plan would allow that in the event of an emergency or urgent care, that you get to your nearest facility and receive your care. Now keep in mind that we don't have contracts with providers outside of the country or outside the state. You may have to pay for services up front, and then when you return home, file a claim and receive reimbursement less any applicable copay. Any other questions? Okay, thank you.
Yeah, we have a couple more right here. Oh, no, yeah, she got them all. Yeah. Nancy's got one last one.
Let me address the two that I have really fast. Okay, and then Nancy will go. Okay. No, that's okay, thank you.
I'm not sure. Thanks.
So I'm currently reimbursed for SDCERS for insurance through my spouse's federal plan. And they want to know when they turn 65 this year, must I switch to a Medicare plan Part B and D through SDCERS? You're not required to go through that plan with SDCERS, but it is recommended that you go to a Medicare plan, as they stated the penalties that will incur if you do not. And if you decide to stay private, yes, we will reimburse you. And the way that we reimburse for those who are dependents on someone else's plan, there are calculations that have been provided by the City of San Diego in exactly how to determine what your reimbursement will be. If you have any questions about those calculations, in every scenario it differs, it's different. Please contact us and we'll be able to provide the exact calculation that we use to determine what your reimbursement will be. It does get a little tricky. And the next question is, does Care Council help with pharmacy issues? Yes, they help with all issues that you may have, even if you just want to call them just to vent about something. That's what they're there for. So please reach out if you have any issues regarding any type of healthcare option.
All right, real quick, a couple other questions here, and I also wanted to address some option C things that I know you probably saw briefly flash before your eyes on the screen, and that is, if you are part of a bargaining unit when you retire, then, and you're in option C, you will go to McGregor, which was selected by the bargaining units, and that's where your option C money will be administered. So if you have any questions or concerns, you do need to go to either your bargaining unit or McGregor regarding those issues. If you were unrepresented, unclassified, or a deferred vested prior to April 1 of 2012, your funding for your option C goes to Meritain. And so this question is somebody who is going to be retiring and was wondering if they have long-term health care. We at the city have a long-term disability plan, so we do not have a long-term health care, but that is something that you can purchase on your own. The city would not, as an active employee, reimburse you. If you are option C, that is something that you can submit for reimbursement from your health savings account. Now, is a domestic partner eligible to be covered on your insurance when you retire? Not under A, B, or the previous ones to that, but for if you have option C, any qualified dependent, and that's a little catch term there, qualified dependent. It has to be an IRS qualified dependent, and yes, you can pay their premiums through your option C. And can you continue vision coverage? Yes, you can cover it under COBRA, not CalCOBRA, and then you can also pick that up with your option C. And I'm done. So thank you very much, and I want you guys to know you have an awesome SDCERS team working on your behalf, so they deserve a lot of credit.
And in closing, I just would like to say thank you all very much for coming out. This is the way we're trying to move towards, to educate you as much as possible to be prepared for anything and everything. And if you have any questions, we're here to address those. We're here to help you. We are City of San Diego employees as well, so we want to give you the best services possible. Thank you so much for coming, and have a wonderful, wonderful day.